Could your daily habits be making your knee arthritis worse? You might be surprised by some of the activities that can aggravate your pain. Today I'm going over 11 activities you should avoid to keep your knees healthy. Let's get started. My name is Dr. Cameron, and for the last 24 years I've been helping the Lucan community alleviate neck pain, back pain, and knee pain. Did you know that knee arthritis affects 1 in 6 Canadians? It's a significant issue that can greatly impact your quality of life. But with the right knowledge, you can manage it better. I will divide these 11 activities into 3 categories: cardiovascular, strength-based, and stretching. Number 1, walking. Walking is often recommended for arthritis, but it can be harmful if you're not using the glute muscles properly. When your quads do most of the work, they increase the pressure on your knees, which can exacerbate the arthritis. Try to focus on activating your glutes while walking. One way to do this is to consciously squeeze your glutes with each step and ensure your stride isn't overly reliant on your quads. If you find that your knees hurt after walking, consider speaking to a specialist who can assess your walking technique. Number 2, elliptical machine. The elliptical is a popular choice because it's considered low impact. However, like walking, it can strain your knees if you aren't activating your glutes properly. To avoid this, ensure your glutes are working harder than your quads. You can do this by slightly bending forward at the hips and focusing on the push through the heels. If you're using an elliptical, it might be beneficial to start with lower resistance and gradually increase it as your muscles strengthen. Number 3, swimming. Swimming is generally good for joint pain relief, but it can also be tricky. Aggressive kicking, particularly with the quads, can stress your knees. To mitigate this, focus on a gentle flutter kick where the power comes from your hips and glutes rather than your knees. Additionally, consider using a kickboard to focus on proper kicking technique without straining the knees. Number 4, cycling. Cycling is another low-impact exercise often recommended for knee arthritis. However, it can lead to overuse of the quads. Adjust your bike seat to a height where your knees remain slightly bent at the bottom of the pedal stroke. This adjustment helps to distribute the effort more evenly across your leg muscles and can reduce the strain on your knees. Additionally, focusing on a smooth pedal stroke and engaging your glutes can make a significant difference. Category number 2 is strength-based activities. So, activity number 5, knee extensions. Knee extensions are a common exercise in gyms, but they can over-strengthen the quads and put undue pressure on the knee joint. Instead of this exercise, consider alternatives like hamstring curls or leg presses that allow a more balanced muscle development. If you choose to do knee extensions, make sure to use a low weight and high repetitions to avoid putting too much strain on the knee. Number 6, quad sets. Quad sets are often recommended in physical therapy, especially for post-surgery. While they can help strengthen the quads, they can also contribute to muscle imbalance if overdone. Once you've regained full range of motion, it's important to incorporate exercise that strengthen the glutes and hamstrings to maintain balance and support for the knee. Number 7, squats. Squats can be beneficial when done correctly. The key is to ensure that your knees do not extend beyond your toes and that your weight is distributed towards your heels. Engaging the glutes and core muscles is crucial. Consider starting with wall squats or supported squats to practice proper form before moving to a more advanced variation. Number 8, lunges. Lunges are a great way to build lower body strength, but they can be hard on the knees if not done properly. To reduce knee strain, keep your front knee behind your toes and focusing on lowering your body straight down rather than leaning forward. Engaging your glutes during lunges is essential to support the knees and avoid unnecessary strain. Category number 3 is stretching. Aggressive stretching. While stretching is beneficial, aggressive stretching can activate protective reflexes in the muscles that actually tighten them rather than relaxing them. This can lead to increased joint compression and pain. Instead, focus on gentle stretching techniques and avoid pushing to the point of discomfort. Number 10, the quad stretch. The quad stretch is a common stretch But if done too aggressively, it can compress the knee joint. When performing this stretch, ensure that you feel a gentle pull and not a sharp strain. Keep the stretch mild and controlled and avoid forcing the heels too close to the butt. Number 11, hamstring stretch. Like other stretches, overstretching the hamstring can compress the knee joint. It's crucial to perform stretches gently, focusing on slow, sustained movements rather than bouncing or pulling. This approach helps maintain muscle flexibility without overloading the joint. Bonus tip. There are two crucial important receptors in the muscles and tendons that determine how the knee joint works: muscle spindle cells and Golgi tendon organs. The names are not important for you to remember, but what they do is they control how much a muscle shortens or lengthens. If the receptors are not firing correctly, then there is a higher chance that there will be a mechanical problem in the knee joint and more pain. This is one of the things that we will check and correct when you're in the office. So, in conclusion, if you've been experiencing knee pain or stiffness, consider whether these activities might be contributing to the problem. By avoiding or modifying these exercises, you can better manage your knee arthritis. If you've been struggling with knee pain for more than 6 weeks without improvement, it might be time to give us a call, 519-227-1363, and don't forget to like, comment, and share.